List and seems to be holding steady. So, first of all, I would like to say good evening, everyone, and thank you again for joining our discussion this evening. My name is Ragnar Hagen, and I am the Manager of Communications for Childcare in the Ministry of Education and Childcare. I'm grateful to be calling in from the territory of Lekwungen-speaking people of the Songhees and the Esquimalt nations. As we're joining this meeting from all across the province, I invite you to take a moment to recognize the territories that you're calling in from. Tonight, I guess, we are pleased to have you all join us for the second ChildCareBC Operating Funding Model Test 2023 information session. The presentation today is the same as what we presented yesterday. However, we've tried to incorporate, wherever possible, the answers to some of the questions that may have already been asked yesterday. So if you're joining us for the first time, then this will all be new information. But if you're joining us for the second time, some of it you may have already heard before. We are once again delighted to be joined by the Minister of State for Childcare, Grace Lohr, who will share some remarks, and then we'll move on to the presentation itself and end with some time to go over any questions you may have. We will try to answer as many questions as possible, of course. However, before we begin, a few housekeeping items. AI-generated closed captions are available, and you can activate the captioning by selecting the closed captioning button at the bottom of your screen. This session is also being recorded, and that recording will be shared to the OFM SharePoint site later this week. The presentation that you see will also be shared and available. Now, we understand you likely have specific questions for your facility or your situation. For those unique situations, you will be able to contact your client relations coordinator directly. This information session is for general questions about the OFM test that are more broadly applicable to everybody. We will be accepting questions through the Q&A function, which can be found at the bottom of your screen. You can submit a question at any time throughout the webinar. However, we will wait until the end to answer questions. That'll be after the PowerPoint presentation. We may not be able to answer all questions today, depending on time. However, we will share written responses to the questions we're not able to get to, including some of the pre-submitted questions to the OFM SharePoint as soon as possible. Again, a reminder that during this session, we encourage you to ask more general questions about the OFM test. If you do have a question specific to your facility, such as funding amounts or unique facility needs that are perhaps not more broadly applicable, we do suggest directing this to your individual client relations coordinator instead. Please and thank you. Now, I am pleased to introduce the Minister of State for Childcare, Grace Lohr. Minister, the screen is yours.
Good evening, everyone. Sorry, just a bit of a challenge there getting off mute. Good evening. I'm really incredibly grateful for everyone spending their time with us this evening. I know for some of you, this is round two, and I really appreciate you coming again to further this conversation, to continue the learning. And to those who are joining for the first time, really glad to have you. I am calling in from the legislature this evening, which is on the territory of the Lekwungen peoples of the Songhees and Esquimalt nations. It's also the territory on which I live and raise my family and represent here at the legislature. Tonight, you'll have the chance to hear from me and the ministry team on our test of a new operating funding model. A new formula-based operating funding model is truly the next step in ChildCareBC. We are nearing capacity on our ability to expand TDAD $10 a day sites for families and communities under the current model. As you all know, as $10 a day sites yourself, the program as it is now requires that intensive one-on-one negotiations and develop a contract. And with more than 5,000 providers across the province, we simply cannot expand the program to serve all families and communities. And yet, as I know you also know, access to affordable quality childcare is life-changing for families. And what we can do with these models better supports providers. And of course, as I think we all share on this call, the need to do more to support and uplift educators. So this is the work that we are looking to do here together. Testing a new operating funding model moves us toward that broader expansion to truly meet the needs of kids and families, and to make sure that we support providers and educators that are doing this work on the ground in communities. So for that reason, your participation in this represents a really important opportunity to provide feedback and input into the process and into the funding model based on your expertise and your experiences with it. And I really thank you for this partnership. Your input, your experience, what we learn together will be so important. Since we started this work in 2018, every step along the way has relied on partnerships with childcare providers, with educators, with communities, and this step is absolutely no exception. The number of participants in the test is not that large, 53 sites, but it represents and is part of what is a very big step forward toward childcare as a core service for BC families. Yesterday's conversation was really productive. The questions were really important, and I think indicative of the learning that we're going to do together. In addition to a lot of good questions last night, I'm sure there will be many tonight. There's a lot to unpack and a lot of information to digest. And I want to reflect that I know the last 6 years have involved a ton of change and a ton of growth in this sector. And that change is not always easy. It often comes with some uncertainty or anxiety. And, you know, we're 6 years into ChildCareBC, and these big steps forward together are how we make that progress. But I also want to recognize that that can be stressful, and to really assure you that the ministry team is ready and available to support you and your facilities through this test phase. Each facility will have their own ministry contact, does have their own ministry contact, and that will help ensure a smooth transition. You're going to hear more from the ministry staff tonight about what the new funding model will look like, and they'll answer some of the questions that you may have and that were submitted ahead of time. And in addition, time this evening after the presentation to have additional questions. But this is not the only time where these conversations can be had or where these questions can be raised. Welcome them in an ongoing way. As 10-a-day operators, all of you have already been part of transformative change. You've already been instrumental in making ChildCareBC the program that it is today. As minister, I get the opportunity to hear often from families and also providers what the 10-a-day program has meant to them, has meant to their communities. I talked to one mom, and just to share briefly, that access to this program and the support of the $10 a day program and the affordable childcare benefit combined actually allowed her to keep her child. She was at risk of losing her child. To say that the work that is happening in your programs and that we're doing together is life-changing is not an overstatement. And your continued collaboration and feedback has helped us already learn, change, and improve so that we can better meet the needs of families, providers, and the workforce. This operating funding model that we're testing was developed based on these learnings in the initial phases of the 10-a-day program, as well as research of models and policies from other communities. And so as part of this next step, this test is about moving us towards predictable and robust funding that considers the needs of educators and aims to lift them up, that aims to recognize and fund the need for pedagogy, what it looks like to have time to do that work off the floor, and that articulates resources and sets expectations for quality care for children and families. And your support at this stage and as we develop the model, your input will once again be really critical. Because it is a test, we want to further improve and advance this operating funding model over the next period. and at the same time want to ensure that the process of this test is a positive change for you as operators and for the families and communities that you serve, because it really is going to be a really positive and impactful step over the next few years with real and tangible benefits for families and educators, children, and providers. So I'm really looking forward to continuing this work with you in the weeks and months ahead. And I just want to thank you again for being here this evening, for lending us some of your time on this Tuesday night, and for your incredibly valuable contributions to childcare and the families you serve across BC. And maybe with that, I'll pass it back and appreciate Ragnar leading us this evening.
I just realized I was on mute. Thank you very much for that, Minister, and thank you for also being with us in what we can only imagine is quite a busy schedule on your end as well. We'll now move on to the presentation portion of today's information session. And joining us this evening are Cal Parmar, Executive Director of Operating Funding Model Implementation, Julie Adams, Director of Childcare Policy in the Affordability Branch, and Sonia Yuli Kalia, Director of Childcare Policy in the Quality Branch. As I mentioned earlier, if you'd like to submit a question, please use the Q&A function at the bottom of your screen, and we'll do our best to answer them following the presentation. Now, over to you, Cal.
Great. Thanks so much, Ragnar, and good evening, everybody. So I'm going to be giving a high-level overview of the OFM and what it is, and then I'll turn things over to my colleagues who are going to be taking a deeper dive into the model itself. And then I'll come back with the learnings that we would like to get from this test in order to refine our model and help bring the rest of the province on board with it. And then the panel will be very happy to take your questions afterwards. So the ministry for the last several years has been doing a lot of exciting work in terms of engaging with our partners across the province, researching, doing jurisdictional comparisons, both nationally and internationally, and coming together to create a best practice funding calculator and policy for an operating funding model that will, over a period of time, take all of our current provider funding models, such as our $10 a day program, of course, and CCOF, and turn it into a coordinated and stable system of childcare funding that will support you and your staff, your facilities, our parents with affordable childcare fees, and also introduce flexibility as the OFM is going to be evolving over time, the more we learn about it in terms of how it's working in practice. And echoing what the minister has already stated, I can't emphasize enough how important all of you, our 53 valued partner sites, are to make this work in the province, and how thankful that you're on this journey with us. And I guess also, as with any test, paving that road to the new future state is going to require close contact and communication. And please trust that we are here for you and committed to work through any issues that we encounter together, because that's how we're going to learn. That's how we're going to evolve the model and accomplish all of those goals that are listed on the far right-hand side of the slide there. So with that being said, I will turn things over to Julie, who will begin walking through the funding model itself.
Great, thanks, Cal. So this first slide is a visual representation of the different categories of funding under the OFM, or the operating funding model. Like Minister Delore mentioned, this model is based on a funding formula, and that formula considers inputs such as the number of operational spaces and the hours and weeks of operation of the provider. As you can see, funding for core services, which is the large navy blue box, is the avenue through which providers will receive the bulk of their funding. Funding for core services is provided through base funding, which is divided into different funding envelopes, and allowances, which for the purpose of the test will be limited to allowances for enhanced Indigenous cultural programming and support needs programming. In addition to base funding and allowances, providers will be required to charge parent fees of $10 a day or $200 a month for full-time care and $7 a day or $140 per month for part-time care. I'll speak more to the different sources of funding for core services over the next couple of slides. In addition to core services, we recognize that some providers will offer services that go beyond what is funded through base funding and allowances. We refer to these as discretionary services, And for the purposes of the test, the only discretionary service that is eligible for funding is for transportation. We expect that as the model matures and is refined, that additional allowances will be added in the future. And lastly, there are limited circumstances in which providers can charge additional optional fees for services. These services must be truly optional for families. Families must be allowed to either choose not to participate or have the option to drop the service at any time and still receive the same quality childcare services as other families at the organization. Cabinet has approved 5 different types of additional services. They are meals, uniforms, custom or bespoke transportation, such as picking up or dropping off a child at their home or their parents' place of employment, extracurricular activities, such as regularly scheduled karate lessons, or additional educational programming, such as language tutors. For the purposes of the test, only providers who are offering these services before October 12th, 2023 will be permitted to continue to do so. Sites cannot introduce these optional services during the test phase. Government will be seeking to learn more about these different kinds of optional services through testing the OFM. And lastly, providers will be able to continue to receive funds from other sources, such as through fundraising, donations, endowments, and grants to supplement their OFM funding. Next slide, please. So this slide speaks to the different funding envelopes that how money is divided. So each of these funding envelopes represent a different purpose for the funding. And there are 5: instructional human resources, administration, programming, operating expenses, and facility costs. These funding envelopes are based on input from the Provincial Child Care Council, advocates, and research, and represent the major categories of cost involved in the delivery of a high-quality childcare service. Information about what exact costs are considered under each funding envelope can be found in the OFM Policy and Procedure Manual and your funding agreement. Your funding agreement will also break down how much funding will be provided under each envelope so that you can clearly see how your funding has been allocated. The distribution of funding across envelopes is based on information on how costs are experienced by providers obtained through the annual provider profile survey and existing $10 a day sites. For example, we know that human resources expenses are the biggest expense to providers, and therefore providers will receive the largest proportion of their funding allocated to their instructional HR envelope. I'll spend a few moments talking about what expenses are funded under each envelope and if and how funding can be moved between envelopes. There are some rules around funding and around how funding can be moved within and between envelopes that you need to be aware of. We'll start on the right with the instructional HR envelope. This is the largest envelope, consisting of 5 categories or line items: wages, benefits, professional development hours and professional development expenses, and paid time off, including vacation and sick time. Sites cannot allocate funding in or out or between line items for this funding envelope without prior written approval from the Ministry. Costs for eligible expenses that exceed the funding amount providing for this funding envelope must be covered through other funding sources and may not be charged as additional parent fees. And any unspent funds from this envelope are recoverable by the Ministry. The administration funding envelope is to be spent on eligible human resources and administrative expenses not directly associated with the delivery of childcare services and not covered by any other funding envelope. Examples of expenses funded through the administration envelope include non-childcare related staff wages, such as those for administrative staff or bookkeepers, office supplies, and accounting expenses. Funding may be allocated from this envelope to other envelopes, but not the HR envelope, but funding cannot be moved into this envelope. Funding provided through the programming envelope is to be used for eligible expenses associated with delivering an early childhood program that meets the expectations of core services. Examples of eligible expenses under this envelope include snacks, supplies, small equipment, cultural programming, inclusion programming, and health and safety supplies. Funding may be reallocated from this envelope to the operational and facility envelopes without prior written approval from the Ministry. Funding provided through the operational expenses funding envelope is to be spent on costs associated with operating and maintaining the facility, excluding rent, lease or mortgage cost, stratus fees, or property taxes. Examples of such costs include insurance, utilities, and routine maintenance activities. Funding may be reallocated from this envelope to the programming and facility envelopes without prior written approval from the Ministry. And lastly, the facility envelope, which is a little bit different than the other funding envelopes in that it uses what we call a cost pass-through model rather than the funding formula. And this is because there was just too much variation in facility costs across the province to use a formula-based model for this envelope. Funding under this envelope is to be spent on eligible expenses associated with the rent, lease, or mortgage of the facility, as well as for property taxes and strata fees. Note that corporations, partnerships, and sole proprietors are not eligible to receive funding for mortgages for privately held assets. And all costs associated with this funding envelope must be with a party that is at arm's length from the facility. Funding may not be reallocated out of this funding envelope without the ministry's prior written approval. However, funding may be reallocated into this envelope from the administration, operational, or programming envelopes. And any unspent funding from this funding envelope will be fully recovered by the ministry. And just to note that rules around how money can be moved in between envelopes are not intended to be the government micromanaging how you run your business, but more, for the most part, sites will be able to receive written approval from the ministry to move funding around to meet their needs. But it's important for us to be able to learn how and when funding is being moved around so that we can refine this model as we move forward. Okay, can we go to the next slide, please? All right, and let's just click twice and bring up both of the boxes. Perfect, thank you. So for core services are those services that providers are expected to deliver to meet the universal standards of quality, inclusive, and culturally safe childcare. Providers will receive an annual funding allocation broken down across the funding envelopes that we just discussed to deliver core services to families. In addition to base funding for core services, providers can also apply to receive additional funds of up to $5,000 per year to fund support needs programming or Indigenous programming. These funds will be prorated based on the operational capacity of the facility. These allowances are available upon request at any time throughout the year and can be applied for through a form posted on the OFM provider's SharePoint site. The support needs programming allowance is intended to help childcare providers increase their ability to welcome children and families of all abilities by covering costs related to offering inclusive and accessible childcare that are not covered by base funding or other provincial funding sources. Funding under this allowance can be used to fund equipment, program resources, or minor facility modifications to enhance inclusion for all children participating in the program, but they cannot be used to enhance staffing, including hiring a support worker, or for individualized therapeutic or medical equipment. Childcare providers who would like to know more about when enhanced staffing, including support workers, are encouraged to work with their local supported child development or Aboriginal supported child development program. The Indigenous programming allowance is to be used to enhance participants' delivery of Indigenous curriculum in collaboration with Indigenous people in their community. It also cannot be used for enhanced staffing. And any unspent funds from these allowances must be repaid to the province. And we are considering how to consider these allowances in the future, and it could be that these allowances are rolled into base funding once we have a better understanding of how they're used. And the next slide, please. And let's click the one button. Perfect, thank you. So we do recognize that some providers may offer services beyond what is funded through base funding. And we recognize that sometimes we may actually want to incentivize providers to offer these optional services. We refer to these services as discretionary services because they are offered at the discretion of the provider in response to their community's needs. For the purposes of the OFM test, there's only one discretionary allowance available, and that is for transportation services. Funding under this allowance is to support providers that use a designated vehicle to transport children between the facility and school, or a collective point of access where a geographical barrier or distance, such as a body of water, creates an ongoing barrier for families. Note that this cannot be used for custom or bespoke transportation arrangements. Funding under this allowance is specific to the costs associated with operating and maintaining the vehicle itself, financing costs, fuel, insurance, and routine maintenance. Other costs associated with offering a transportation service, such as drivers' wages and traffic fines, are not funded under this allowance. Neither are activities not associated with the transportation of children, such as trips to the grocery store to replenish supplies. Expenses of these sorts will be funded out of the administration envelope. Like the Support Needs Programming and Indigenous Programming Allowance, providers can apply for this allowance through the form posted on the OFM providers SharePoint site. Providers will need to project their annual transportation cost, and the allowance will be prorated and added to their OFM monthly payment. And any unspent funds from this allowance must be repaid to the province. I will hand over to my colleague Sonia.
Sonia, you are on mute.
Thank you. Sorry, I just don't see my video. I still see Julie pinned. Okay, thank you. Good evening, everybody. Great to be here tonight. Really looking forward to walking you through the pieces about wages and benefits, and really hoping that I can answer a lot of the questions that were raised that came in previous to this session. And if you attended last night's session, some of this, again, will be repeats, but there's a lot of information to go over. So you might also pick up on something new as well. So as mentioned, I'm going to be going over the generalities of how this wage grid works, and also in regards to benefits and paid time off. If you have any specific questions in regards to your specific scenario, please reach out to your client relations coordinator. If you have any general questions about anything related to this topic, of course, please include them in the Q&A and we'll do our best to answer them. So before I dive into this, I really want to emphasize the point that the minister started off with, that this is a test and you are active participants in helping us test this model, grow this model, and also influence the direction of this model. So you have a really important role in this, and that's why we value your participation so much, because without your participation, we wouldn't understand what needs to be done to be able to implement this model across the province. So I think that's super exciting to be able to have that role to test this out, to give us feedback on what's working, some areas that may be tricky, so that we can use that feedback to really improve the model as we look towards implementing it across the province. So with that in mind, just want to emphasize that this is a test. This is not intended necessarily to be the endpoint or what is developed that goes out province-wide, but it is a starting point. This is where we're starting. We're seeing what works. We're seeing what needs to be fixed. Everything that is out there needs to go through this testing phase, and this is what we're doing now with this operating funding model. So first off, I just want to give a broad overview about how sites are funded. I do have a slide later on where I'll give a bit more specifics, but in terms of funding for instructional HR, sites are funded for the full allotment of their staff for all hours that they're open and providing care to children. So what this does is it provides some additional flexibility in the funding that you receive to be able to pay your staff wages, and also to look at what kind of benefits and paid time off you want to do. So I'll explain a little bit more exactly how that works, but I just want to provide that initial context. In developing the wages that are in this wage grid, we looked at a number of different considerations. So we looked at information that's submitted annually through the provider profile survey, that we received information on wages from across the entire province. We also connected and looked at wages that are paid in the public sector. So what are public sector employers paying under their collective agreements, and how does that align? And those, we also looked at, is there regional variations that we need to be considering, and is there a need for some supplements? And on the piece of regional supplements, at this point, we haven't instituted any regional supplements. It's the same wage in all areas of the province, but we do recognize that that is an area that we may need to gather more information on, and it is something that we may need to look at as this model evolves. So that is, again, where your feedback is really important, and we can better understand if that's something that we may need to bring in is regional supplements. I also want to note that going into the operating funding model test. The intention is that in regards to the wages that you're paying for your staff, that none of your staff would have to take a pay cut coming into this model. We definitely don't want to see that. And I'm going to explain how our funding works to enable, to support paying those wages to your staff. As well, looking at these kind of separately can cause some questioning and not really fully understanding how this works. So it's really important to look at your funding envelopes and look at, how can that be used and supporting your wages, and maybe having those conversations with your client relations coordinator if you have questions about your funding envelope under this instructional HR, which considers wages and the benefits and paid time off and things like that. As well, as Julie just mentioned, the funding in the instructional HR envelope in one way is fixed. You cannot move funding out of this. Obviously, we want to support good wages and a compensation package for your staff. So we don't want you moving funding out of the instructional envelope, the HR envelope. If you notice that you have some excess funding in some of the other envelopes, what we're asking is that you connect with the ministry and request if you can move some of that excess funding into your instructional HR envelope. So it's not that you can't move funding into the instructional HR envelope, but we want to understand why you're moving that funding, how much funding you're moving. And again, this is all part of our learning so we can understand where we may need to make adjustments in the future. Okay, before I get into the specifics of this wage grid, I just wanted to explain some of the announcements that you may have seen on October 30th, where we announced an enhancement to the ECE wage enhancement, as well as a new grant. And I want to explain how they apply to OFM test participants. So I'm sure you're all familiar with the ECE. It's an additional wage enhancement that the government provides to ECEs working in licensed childcare facilities. As of current day, it's $4 an hour. As you likely saw in the announcement, as of December 1st, it'll go up an extra $2 to $6 an hour. The ECE will not be available to the OFM test sites. So ECEs working in OFM test sites won't be able to apply to the ECE. And I know at first glance that can be a little bit shocking or maybe concerning, but what we did when we developed this model is we looked really hard at how the funding is distributed. And the reason why the ECE is not applicable is because the funding within this envelope for wages and compensation is intended to provide sufficient and compensatory wages as if staff were able to access the wage enhancement. And as well, participants that are participating in the wage in the OFM test are also having that access to the funding for benefits and paid time off that is not available to other centers that are not participating in the OFM test. And then the other piece of the announcement that you may have seen was about the specialized certification grant. So this is a new grant that we're launching that will be available January 1st of next year. And this is available to ECEs that have one or both of their post-basic certifications. So their infant toddler educator certification or their special needs educator certification. As long as that ECE works in a licensed childcare setting or in an Aboriginal Head Start and provides childcare to children ages 0 to 5, they are eligible to apply for that grant. They also need to have worked in the sector for the last 12 months. They will be applying individually for those grants, and all ECEs that meet those requirements are eligible for the grants. So ECEs working in OFM test sites can also apply for this grant. So that's $2,000 if they hold one post-basic or $3,000 if they hold two post-basic, and that'll be available on an annual basis for the next 3 years. So that's great news that ECEs with those post-basics across the board will be able to access that additional funding. And just to reiterate, ECEs need to apply for that individually. It will not be going through the centers, unlike the ECE week, and they'll be applying through ECEBC to access that funding. Okay, now I'm going to get into the nitty-gritty of the wage grid. And there's a simple slide, but there is a lot going on here. So first off, you'll see that the wage grid is based on roles. We have ECE assistants, school age providers, and ECEs. And the reason that was based on roles and not based on things like certification levels or education or experience is a multitude of reasons. One is that we needed to start from a place of where the ministry can easily gather information. And this is something that we can easily confirm is the role that somebody is playing. It's a bit more tricky to confirm things like number of years in the sector and experience and things like that, because ECEs may move around from center to center. And so it's a bit more challenging to build that in at this time. As well, this is also aligns with how many other wage grids in the public sector work in regards to where it's based on the role that the individual is playing in the center and not based on their educational level or whatnot. So this aligns in that sense in being role-based. I know some of you may be having questions about, well, why does a school age provider, is their hourly wage higher than an ECE assistant, where an ECE assistant has more educational requirements than the school age provider. So the way that this was built out is that it's based on the level of independence and responsibility that each of these individuals plays. So a school age provider works independently within the school age center, and they're responsible for the children in their care. That's similar to an ECE educator, where they are the senior staff and they are responsible for the children in their care. The ECE assistant has a slightly different role. They are usually working under the supervision of an ECE, and so they don't have as much autonomy, independence, and responsibility as an ECE or even as a school age provider. And I understand there may be instances where an ECEA steps into the role of an educator, but when we look at the generalities, their responsibility is as that kind of the secondary person acting under the supervision of an ECE. So that's where you'll see how we determined the minimum wages and the funding levels. Now I'm going to describe how the minimum and funding levels work. So the minimum hourly wage is the minimum wage that these individuals must be paid. So you cannot pay below the minimum hourly wages, but you can pay above. And that's partly where the funding level comes in, is that the funding you'll receive for each of these individuals is the column there, receive funding level. So $23 for every ECEA, $25 for school age providers, and $28.50 for early child educators. But this is also not the maximum you pay. So this grid does not have a maximum funding level. It's up to each center to determine how they can allocate funding, how they can pay their staff based on the funding envelope that they receive. So just want to make that really clear that these are not maximums. It's really up to each of you to determine what you're able to pay your staff looking at your entire funding envelope. In addition, there's this hourly premium, $2 per group hourly premium for the program leader. And the groups are based on the group sizes that are within the child care licensing regulation. So, for infant toddlers, the maximum group size is 12. So you have one individual per that 12 infant toddler children that the $2 per group hourly premium could apply to. Same thing for 3 to 5. They have a larger group size. You'd have one individual that could apply to. However, just want to note that this is also a flexible amount. While it's been developed to support and provide an enhancement to the wages of an individual who's playing maybe the senior role or has the most experience or has that kind of program leader role, then it's intended to enable the centers to recognize that and also to support that. However, it's part of the funding that's provided in your wages envelope, in the bucket of funding that you receive for wages. And what that means is that you can choose to apply this hourly premium in a different way. So if you don't have a clear program leader, you can allocate it amongst your staff and give a small hourly bump up to each of your staff. Or you can choose to allocate it in a different way. However, if you do choose to allocate it to one individual, then they are able to receive this for the hours that they're working on the floor. So it only applies for the hours that the individual is providing direct care to children. If they're on vacation or taking a sick day, then the $2 per group hourly premium cannot be applied to them. It would be applied to, or could be applied to, the person who's coming in to replace them while they're off, or it could be dispersed amongst, you know, all the staff that are working on that day. So it is based on working directly with children. Let's see if there's anything else here I want to quickly highlight. So I just want to highlight the point about the flexibility, is that what we're trying to do in this funding envelope is provide centers that flexibility to be able to allocate wages in the way that works best for their center, and recognize things in their center that we may not be as easily to recognize, and also to recognize the variation in centers and the way that they fund. And the way that you allocate this funding will really be helpful for us in understanding what is actually happening on the ground, and will help us iterate as we determine, you know, any changes that need to be made to this wage grid. And as I mentioned, I have a slide later on, where I'll describe a bit more how that flexibility works, so you can kind of get a better sense of how that could apply to your center. Okay, so we can move on to, one other piece I just wanted to mention. There was a question also about if you're a manager that plays an administrative role and also works on the floor, and how your wages would be allocated. So it's really based on the role that you're playing. So while you're working on the floor, your funding would come out of this instructional HR funding envelope. For the hours that you're completing your administrative duties, your funding would come out of the administrative funding envelope. So that's how that's worked. It's really based on where you're spending your time, and that's the envelope in which that funding would come out of. Okay, let's move on to the next slide, please. Okay, so this provides an overview of benefits, paid time off, and what that looks like. So for benefits, all sites are provided with 18% funding based on the funded level of wages for all of their staff. So it's not 18% of the wages that you're actually paying your staff, but 18% based on the percentage of wages that that's based on the funded level that was in the previous slide. So it's those funded rates that we're looking at are key to this 18% calculation. And this addresses both the statutory required benefits, as well as provides some leeway for you to determine how else you want to apply benefits and what other things you want to cover for your staff. Secondly, we have paid time off. These are annual paid days off per FTE. So it covers statutory holidays, and it provides 15 vacation days and 5 sick days. There is some leeway within this. I mean, obviously, we need to meet within the Employment Standards Act. So you need to cover staff statutory holidays and provide those 5 sick days. But there is some leeway with the 15 vacation days. If you have some junior staff who you're only required to provide 10 vacation days to, you could allocate 10 vacation days to them and use the 5 extra days to provide to a more senior staff who you want to provide additional vacation days to. So again, there is a bit of flexibility in those vacation days if you want to recognize things like seniority and things like that. Third is the professional development hours. So every FTE in your center will be provided 15 hours of professional development per year. So this covers both their wage while they're completing the professional development. And then we also have funding to support the cost of the professional development. Then there's professional development expenses, and this provides $250 per FTE that can be used to support various professional development related expenses. It can be used for training, for third-party costs, for attending conferences, things like that. And while the 15 hours is specific for each individual FTE, so you cannot change that allocation around. Each FTE needs to be allocated those 15 hours. To the $250 is a flexible cost that the center can decide how they want to use that money. They can pool it in different ways. So another important piece here, all of this funding is based on centers that are operating full-time. And full-time is defined as opening 10 hours a day for 5 days a week and 50.2 weeks out of the year. If your center is open fewer hours than that, then your HR line items will be prorated, as well as if your center is open longer hours, then you'll be prorated to receive a little bit more funding as well. Let's see, just checking. Okay, so let's move on to the next slide. And then while we do that, I just want to note that each of the wages and then that kind of benefit slide that I was just on, those are considered different line items within the instructional HR envelope. So if you decide that you want to beef up your benefits package and pay, a little bit lower wages, you have the option to do that. However, that is another situation where you need to connect with the ministry and request permission to do so. Again, we just want to learn the reasons why centers may be asking to do that and understanding what is happening. So that's a conversation you'd need to have if you want to change around the funding between the wages and the benefits and paid time off areas. So here we have a little bit of a scenario, and it shows how the piece works when I started off saying that a center is funded for the full staff complement for the full hours that they're open. So this is based on a fictional infant and toddler scenario with 12 children. Based on the childcare licensing regulation, they are required to have 3 FTEs, an infant toddler educator, an ECE, and then an ECE assistant. So actual staff in the room is 3. However, under the OFM, they would actually be funded for 4.8 FTEs. So we have the minimum hourly wage rate for the 4.8 FTEs. The orange bar above that is the funding level, so the difference between the minimum wage and the funded level. So they receive funding, that additional top up in funding up to the funded level. And then the purple bar above that is the additional top up for the program leader. So the $2 per hour hourly premium. So that's the full piece of funding that would go into the HR wage envelope. And then that would go to the center, and the center could decide how to allocate that. And they could determine what wages they want to pay their staff based on that funding envelope. And as you see, they're receiving funding for more than just the minimum wages, more than just the funded level, because they're receiving funding for more FTEs. So a center may decide to use that to bump up the wages of their staff and pay even above the funded level. And if they have the funding available in their envelope to do so, then that's within their discretion to do. So again, you can pay above that funded level by looking at your wage envelope. This wage envelope also is intended to cover things like those periods of paid time off. So statutory holidays, staff taking vacation days, staff taking sick days. And those are the funded levels. So the 15 vacation days, the 5 sick days, and the professional development hours that I spoke to. It also supports wages for the people that need to be coming in to replace staff while they're away. So it supports the staff wages while they're off and had their paid time off, and it also supports you hiring a replacement staff to come in and work in that to replace that staff. In addition, it provides funding for things like breaks and coverage, so that there is funding to support all aspects and enable staff to take breaks as needed. Within this as well, if a facility wanted to, as I mentioned before, one thing that they could do is say, I want to have a more robust benefits package, or I want to provide more vacation days than the allocated 15 days of vacation days per FTE. And if they have the funding to do so within their funding envelope, so they set their staff wages, they're like, we still have a little bit more. We think we can cover all these paid time off pieces. We still have some more. We want to bump up, some of those vacation days for our staff. Then, as I mentioned, that's something that's optional for you to do. But again, you do need to have that conversation with the ministry just to say, this is what I want to do. This is, my plan. And as long as you're meeting that minimum hourly wages, as I mentioned in that first slide, then there is the option of doing that with the permission of the ministry. So that's kind of where the flexibility comes, is that you do have flexibility to maneuver within your HR envelope and enables you to pay staff at the rate that they're receiving right now, and also to be competitive with other centers in the field and staff that are going to be receiving that $2 per hour additional through the wage enhancement. It enables you to be competitive with those by enabling you to kind of address the wages within your center through this funding package. So hopefully that helps you understand a little bit. I know it may not be super clear until you start diving in and maybe even having those conversations with your client relations coordinator, but hopefully that provides some assurance that there is a good amount of funding within your envelope to be able to pay a number of different scenarios. Okay, I think we can move on to the next slide.
Great. Yeah, that's back to me. So thanks very much, Sonia. Lots of important information. I thought it would be also important to highlight what we're hoping to learn about, throughout the duration of the test. So what is all of this leading to? And where do we need your partnership and help the most? So that includes, first and foremost, of course, we have to validate that together we can successfully implement and run operating funding model together. We need to determine whether and where funding levels are sufficient for providers to support quality care. We need to understand your needs and how you use funding in real time, and then adjust that model accordingly. We need to gain understanding on how the model works for different provider types. So, for example, Indigenous providers. We need to support provider partners to maintain their operations and also gather information to determine if changes or adjustments are needed before broader implementation, and also develop that user-friendly IT system, which is really going to help us scale the OFM to a much wider audience than just a $10 a day program, where we want to get to that goal of eventually getting all of our CCOF sites on board as well. So the next slide, please. Sure. Great. So in terms of what's happening next, we are going to be moving into the question and answer portion of the session. So thank you so far for the questions that we've received. They're really good and important questions. And we've grouped them into broader themes, and we'll answer some of those in a few moments. However, I should mention that we may not have time to answer all of the questions that were submitted. So for those of you who are wondering where you can find the answers to your submitted questions, please visit our OFM test SharePoint site, which you all should have access to. Now we're going to be posting your Q&As there in the coming days. And also, as always, if you just want to speak with one of us and talk through all your questions, please reach out to your dedicated client relationship coordinator. They're the ones who would have reached out to you to deliver your welcome packages to begin with, and we'll be very happy to help you. And before I turn things back over to our communications team to start the Q&A, I wanted to address first the fact that I've been seeing some questions regarding funding and funding levels, and there's a couple of things I'd just like to talk about first from our program perspective. So, if your questions are on funding are site specific, please be assured that we are noting them down. And I would also ask you to please direct those specific questions to your dedicated client relationship coordinator. And also, OFM is going to have the same positive impact to parents' pocketbooks as the $10 a day program, in that we're going to be continuing to lighten the load in this test intake by keeping the parent fees to $10 a day or $200 a month. And I can say that in our OFM test for providers, your needs will be met. You know, there's a realization, as with any new program, there's a bit of a learning curve, and there's admittedly a lot of detail in how the model works. There's been some questions about wages and coverage and funding levels as well, and it's all completely understandable, because for all of you, this is a change in how funding will work, and we will work it out together. Our staff are available, we're ready, we're willing to support you with your questions. And it's key that during this very exciting change to remember that your success as a site is our success as a program administrator. We're very important partners. We want you to be successful, and we will do everything we can to make sure that that happens. So I just want to leave you folks with that, and I will turn things back over to Ragnar to start our Q&A portion.
All right. Thank you very much to Cal, Julie, and Sonia. That was a lot of very good information. We have about half an hour here left, so let's get right to the questions, as I know that a lot have come in and you guys are looking for some answers. So we will move the first question tonight over to the minister, and it's kind of a wide-ranging one. What does participation in the OFM test look like?
Thanks so much, Ragnar, and thank you so much to the whole team here for walking us through there. I've been following along with the questions, and some really good ones, and I'm glad we'll have a chance to answer them. So participation in our operating funding model test is about a new way of funding your program. As you'll have received in your welcome packages, and will be able to connect with your individual person on, it is based on a funding formula for your delivery of care, as an alternative to the way that we've been doing $10 a day. So certainly it's a big change, and it is the next step in ChildCareBC, but it is really based on what we have learned from you and the $10 a day sites across the province. And we've done a lot together already in these last 6 years. We have delivered those incredible savings to families. I learned a lot about how we can properly fund childcare centers to be able to deliver that low cost quality childcare, low cost to families, that is. And as $10 a day sites, you really are leaders in the childcare sector, having these ongoing contributions to this chapter of childcare here in BC, and participating in this test will move us to the next phase here. And again, just a recognition that this change no doubt comes with a lot of questions and some undoubtedly some anxiety of the transition, and the team at the ministry will be here to support that participation and that transition.
Thank you for that, Minister. The next question goes to Julie, who we've already heard from. Our center needs 15 minutes for setting up and another 15 minutes for closing duties. This is before and after children arrive and leave. Would this be considered part of the operating hours, or is it only when children are present?
Thanks for the question, Ragnar. It's a really great one. So like Sonia mentioned, facilities will be funded for all of the hours that they are open, and they will receive equal funding for all of the hours that they are open. But we do recognize that there is time when staff need to come early to set up, or at the end of the day when they need to clean up. So within that operational or instructional HR envelope, the providers would have the flexibility to allocate wages to those for those purposes, as long as it fits within their overall instructional HR budget.
Thank you, Julie. Now back to the minister with a question around inclusion. Someone writes, I see that an inclusion policy is required for my program. What does that mean? And am I supposed to submit anything to the ministry?
Thanks for that. And I know that as childcare centers, as $10 a day childcare centers, your commitment to serving kids and families includes serving kids and families with diverse needs. So as part of this test and this ongoing work, because we do indeed have a lot of work still to do on ensuring inclusion in all our childcare programs, we want to ensure that providers and early childhood professions are supported in delivering inclusive and quality care. And so that's why we're asking those who are participating in the operating funding model test to develop and implement an inclusion policy. An inclusion policy is a operational policy written by the provider to describe how your program, how your care, and how your early childhood educators will be able to support families with support needs and then deliver inclusive care. So it outlines steps providers are going to take to prevent, reduce the exclusion or termination of children from your program. It's not meant to mean that providers must accept all children, regardless of their capacity to meet their needs, but is about those steps and the work that the program is doing to increase inclusion. Ministry is not evaluating or reviewing childcare providers' inclusion policies at this time, but the ministry may reach out to you to learn more about your experience in developing and implementing an inclusion policy. Again, we want to learn alongside you as we do this work. There's, of course, a number of resources that providers can access to help develop and implement, including the Inclusive Childcare Toolkit and consultation with the local supported child development program. And I'll also say this need for inclusion and educators who have the expertise is part of the reason for the additional funding for those with the post-basic specialized credentials, including the special needs certificate. Again, trying to incentivize and recognize those skill sets, that extra education that those educators are bringing to the classroom. Thank you.
Thank you for that, Minister. We're going to follow that up with another inclusion question, this time going over to Melanie over in the inclusion branch. And as you haven't spoken yet, please introduce yourself. And the question is, specifically for inclusion needs, if wage inputs are inflexible, how do we pay for the additional staff member required to make inclusion for some children possible? And who will decide when an additional staff member is required?
Thanks, Ragnar. I really appreciate this question. My name is Melanie Foster, and I'm one of the managers of childcare policy, and my team focuses on inclusive childcare. So certainly we want to get to a place across BC where all children are supported to fully belong in quality childcare programs. And we acknowledge that for some children, this may require additional or enhanced staffing. Enhanced staffing to support children with support needs continues to be funded through supported child development and Aboriginal supported child development programs. Beginning in 2022-23, an additional $31.8 million has been invested into these programs, and this funding is reducing wait times for supports. Consultants within these programs have the expertise to determine when enhanced staffing is required to meet the needs of a child or children. So OFM test sites are encouraged to work with their local SCD and or ASCD program regarding the needs of individual children within their program. Childcare providers can also access provincial resources that support capacity building for inclusive practice. The minister mentioned the Inclusive Childcare Toolkit. There's also the Foundations of Inclusive Childcare online training, and then the soon to be released Behavior in the Early Years online course. OFM test sites may also want to contact their ministry client care representative if there's further questions regarding enhanced staffing to support inclusion within their program. And these conversations will support our understanding and learning. Thank you.
Great, thank you for that, Melanie. Next, we're moving back over to Julie. Would you please clarify, if we request to move money into our HR envelope, should we expect those requests to be approved?
So I can't say for certain, and I can't give a guarantee that yes, your request will be approved. Those requests will be looked at on a case-by-case basis to help us understand why the funding is being moved and for what purpose. But I think it's safe to say if it's a reasonable request, it's very likely to be approved. But again, I can't 100% say with certainty. But our goal is to be flexible and to support you to operationalize the model as best you can.
Thank you, Julie. Is this something that maybe the client coordinator would be able to help with on an individual basis?
Yes, that's exactly who you would reach out to. So that's who you'll be having that conversation with around, this is what I want to do and this is why. So that would be the client relations coordinator that would help with that.
Great, thank you, Julie. Next, we're going to be moving over to Anne, who we haven't heard from yet. And the question is, how much administrative work on tracking and reporting will be required in the new test? And what will reporting look like for the new OFM test?
Thank you, Ragnar. Good evening, everyone. My name is Anne Parker, and I'm the Acting Director of Procurement and Assurance in the Childcare Division. So the reporting requirements under the current OFM test model are very similar to what you are used to from your $10 a day agreements, in that we will have monthly reporting requirements as well as sort of the annual financial statements and financial requirements that we'll be asking you to submit. We are in the process of finalizing and streamlining a way for you to do that. But again, expect a similar way of being able to report to us. Again, the extent, of course, as you've heard, the model has changed there a little bit. And I think the importance here is that we're learning from you and we're learning with you. So likely the reporting is going to change over time as well, as we hear from you and what works and what we may need to find out more about as well. But very similar in that there will be various components regarding HR or how you're spending costs, etc. So you can find more information in your funding agreements in the Schedule D portion of your funding agreements. And again, please feel free to reach out with any further questions to us.
Thank you, Anne. Next, we will go back to the minister. How does the new model consider cost escalations, such as inflation?
Thank you for this. And another really good question. Times have been extremely challenging on the cost escalation front. We know this for individuals, families, communities, and of course, childcare is no exception. So recognizing that these have been challenging times on this front. So under the current eligible expenditure model, cost escalations are considered by means of inflationary increases, as the funding for providers is based on the underlying expenditures. However, as the OFM provides a new and formula-based model where centers are funded in a standardized way based on the childcare services that they provide, including care categories, operational hours, operational capacities, we may need to consider potential cost escalations in a different way. So we're still working to define that mechanism. And again, this is where our collaboration, where our learning from you will be really important. So whether this is going to be an inflationary increase similar to the existing 10-a-day program, or an update to the calculator that gets us our funding formula, your feedback is on this, and the adequacy of funding is going to be really important along the test to get to the best answer for that. Of course, with at the base, understanding that cost escalations can create and do create significant pressures for providers. So along the way in this test, we'll be working with you to learn and develop the best path forward.
Thank you for that, Minister. Our next question is going to be directed back to Sonia on wage enhancement. If the additional $2 an hour wage enhancement that was announced will bring the ECE wage to a median of $28 per hour, why will the OFM test be capped at $28.50?
Thank you for the question. And just want to clarify that there isn't a cap on the wages. So the maximum wages are not capped for any facility. We just have the funded amounts. So those are the amounts that you'll receive funding for, in addition to the extras that I noted. So there's an extra $2 per group for the program leader, and then the additional funding where you receive funding for the full staff complement for all hours that the center is open and providing childcare. So that provides some buffer to provide some additional funding to your staff. And the intention here is definitely to enable your center to provide the funding that makes sense for your staff. And there is the ability to provide all of your staff, with adequate wages. If it allows in your funding envelope, that could even potentially look like paying your staff a little bit above the funding level for all of your staff. So again, it's really kind of you need to take a little bit of time to kind of dig into the details of your funding envelope and calculate what may be possible for your center to enable you to provide the funding for your staff wages that meets your needs and addresses the needs of your staff as well. So hopefully that addresses that question.
Great, thank you, Sonia. Next, we have another question around staffing and how that's calculated, and this one will be directed to Anne. We have an operations manager and understand this role falls under under the administration envelope. How do benefits and wages, etc., work here? Is this calculated in the admin envelope separately?
Sure, thank you for that question. And I think maybe just a clarification there. So the instructional HR envelope and the admin envelope are two separate envelopes coming with sort of the different provisions that you heard about tonight as well. So in the scenario as described, how I understand it, the operations manager is not working on the floor. So again, kind of the rules that were shared by some of my colleagues tonight, specifically relating to the trial wage grid, relate to educators that are working on the floor. You do have flexibility of how to allocate those wages, as Sonia has described. I think, of course, if you have the funding available in your admin envelope, you may choose to continue to pay them the wages. But the importance here is that we don't set any sort of requirements in that envelope, just ensuring that you operate within the funding that's provided to you in the admin envelope, or considering sort of moving between the envelopes, as you've heard. So I think this is more of a question on how to split the wages, but of course, no requirement from our side to keep particular wages in the admin envelope.
Excellent, Anne. Thank you. All right, turning ourselves back to the minister once again. How were the OFM test sites selected, and how did we determine how much money to give each site and within each envelope?
Thank you. So we chose these sites based on a few criteria here. As we've said a couple of times, this is a test. We want to make sure that we've got this model right. We want to make sure that there's sufficient funding for providers and for educators to meet the needs of providers, kids, and families. And so we focus largely on the 0 to 5 age category because in this ChildCareBC work, we work with our federal partners, and they are focused squarely on the 0 to 5 ages. And so through our funding arrangements with the federal government, we need the bulk of our attention to be there. That said, as we as a province choose to step into that before and after school care space, because we know families' childcare needs don't end when their children turn 5. It's why we extended the fee reduction initiative to include before and after school care in September. We know that's a segment of care that families need and that we need to invest in. So the bulk are on the 0 to 5 age category. About 15% are school age spaces to help inform the wage grid when it comes to responsible adults, to inform the supplemental allowance for transportation, for example. But we also stepped in here to make sure that we had a mix of different care providers, not-for-profits, private providers, Indigenous-led, $10 a day sites. So we needed a mix there. We also need a geographic mix. So we have sites in all the health authorities and in different corners of the province. Again, looking to make sure that we understand the impacts and how the model works and what we might need to change for different communities. In terms of what went in each envelope, a lot of this is the learning that we've done from the $10 a day, and from hearing what gaps still remain. And so all of that together has informed the funding levels, but also the sites, the 53 sites we chose.
Great, thank you for that response. Now we're moving back over to Julie. How will the funding model be adjusted if a new member of staff is hired?
Thanks for the question, Ragnar. So the funding model itself is based on inputs such as the hours of operation, the weeks of operation, and the number of children that access, or number of operational spaces at the facility. And that calculates how many staff will be funded under the model. So within the provider's instructional HR envelope, they've got the flexibility to best formulate their own staffing cohort, as long as that cohort fits within their instructional HR budget envelope for wages and benefits and all of the other things. So if, as the slide that Sonia showed, where the facility has 3 staff, but they're funded for 4.8, so there is that bit of a buffer in the instructional HR envelope that if a site decided they wanted to hire an additional staff member or perhaps a part-time staff member, they would be able to do that as long as it fit within their instructional HR budget.
All right, thank you, Julie. That makes sense. Next, we're going back to Anne with a contract question. Someone has asked, why am I signing a 3-year contract as part of this test phase rather than a shorter one?
Sure. Thank you for that question as well. As you may have heard, we're sort of speaking about the initial phases of the test, so want to make sure that there is no confusion there. Of course, this is how we're rolling it out initially to the 53 sites, but as you've heard earlier this evening, the plan is to roll this model out more broadly thereafter and take away the learnings we hear from you. So the 3-year funding agreement terms are very much in line with what we currently have for the $10 a day sites. And again, we're trying to stabilize funding to providers, giving you some stability over a 3-year term, as you've heard the minister speak to learnings and taking into consideration cost escalations as well. That's of course a part, but again, we really want to stabilize the funding that you're receiving over a 3-year term and giving you some stability there.
Great, thank you, Anne. Back to Julie. A question is asked, how many days of emergency closures are built into the funding agreement?
Good question. Thanks, Ragnar. So due to their kind of unpredictable nature, emergency closure days haven't been built into the funding formula per se. So it's not that you're getting kind of your base days of operation and then an additional amount on top of that. But we do recognize, and we've certainly seen over the past several months, that emergencies happen and sometimes they affect childcare facilities. And so facilities will be able to close for up to 14 calendar days before there's any adjustments made to their operating funding. And then after that 14 days, it'll be a conversation with the ministry around how best to provide funding to support the childcare provider. Sometimes it may be that the provider is able to open in a day or two beyond that 14 days. Sometimes they may be looking at significantly longer. So we would need to assess that on a case-by-case basis. And just a reminder that if providers are required to close for emergency circumstances, that we do require them to contact the ministry as soon as possible, and ideally before the closure begins, so that we can have that on our radar and start working together to make sure that the provider is supported through that process and that very challenging time. Thank
you, Julie. Our next question is a little bit long, so please bear with me. It's going to be directed to Anne, and it's regarding HR funding and determining wages. Government has said that a leader in a group cannot receive the $2 top-up for the hours that they are not working with children. However, at the same time, you say that we receive a lump wage funding amount that we can decide how to allocate as long as we are paying the minimum wages as set. So, if we have an employee who works on the floor and in the office, can we maintain their determined wage even when they are doing office hours or on vacation?
Thank you for the question, Ragnar. And I think I maybe briefly touched in an earlier question around that as well, sort of speaking about the split between the instructional HR envelope and the admin envelope there. So the $2 are being funded for the program leader in any given sort of based on the hours of operation, as well as your operational capacity and sort of the children, the licensing groups that you're serving. So again, that's how the funding is determined. How you determine to choose to pay your administrative staff, that is really up to you, as long as you do so within that allocation that you have been provided in the admin envelope. So again, nothing precluding you from keeping that wage in place if you can support that with your administrative envelope funding. And I hope that clarifies that question there, Ragnar. I know it was long, so I hope I got all the pieces there.
Great, thank you for that. And I'm just noting the time, but I do believe we have enough for one more question. This is for Sonia. Will there be a cap on the amount of individuals that can access the grant? Example, the first 1,500 applicants will receive funding. And I believe this is relating to the specialized certification grant.
Thank you, Ragnar. Yeah, so in regards to the specialized certification grant, there's no cap on the amount of individuals that could apply for that funding. We do have sufficient funding available to support all eligible ACEs with those certifications to access that grant. But obviously, it's always a good idea to apply, as early as you're eligible for it, because then you can access that funding and have that funding available to yourself. But just to reiterate, no cap. Thanks.
Great, thank you, Sonia. And that is an annual grant that will be available.
Yes, correct.
Okay, I think we'll be wrapping up the info session at this point in time. I would like to thank each and every one of you for joining us here this evening, whether you're an operator, you're a staff member, or you're a part of the government's subject matter experts that have graciously provided their expertise tonight. Questions that we were unable to answer or unable to get to will be provided on the OFM Test SharePoint site as soon as possible. And we'll be posting links to watch the recording of both this evening's session as well as yesterday's. And the PowerPoint presentation that was provided will also be posted to this site as well. Finally, I do want to ensure you that your perspectives and input are incredibly valuable as we continue to work together to deliver the vital childcare services throughout British Columbia. And before we close, I will just hand it over to Minister for any final words.
Thank you, Ragnar. And again, thanks to the whole team being on point here to answer questions. I followed along in the questions that were popping up and that were being answered, and it's clear to me that we're going to learn a lot, even just through this process of getting off the ground. Included in your questions for us on the operating funding model also contains some important information about how you operate, what's important to you as a center. And so I think the process of getting some feedback from you on how to think about this has already begun as we seek to answer questions for you to get us started. I am truly very excited. I know there's a lot to take in, a lot to digest, and a lot to work through as part of this test. And I know that it really is going to help us, all of us and this sector, take that next step forward for families and communities. And so I thank you for being a part of it. And just a reminder that your opportunities to ask questions, get clarity, get some specific information for you and your center is not over at the end of this information session by any stretch. You'll have your individual person to go to work through this together. We already have our first test site signed on and ready to go. And so I'm really, really looking forward to continuing this work alongside you, for the educators that work in your centers, and for the families that you serve. Thanks for being here tonight, and thank you for the partnership.
Great. Thank you for that, Minister. And thank you once again to everybody that was able to attend either yesterday's session or today's session. We absolutely appreciate everyone, and for sending in your questions that we were able to answer. So once again, all the information will be put up onto the OFM Test SharePoint as soon as possible. And if you do have those specific questions, to reiterate what the Minister just said, please direct them to your individual client relations coordinator, who will be able to help you out. With that, have a great evening, everyone.